So the general topic is all about balance. Balance is a critical part of what we do. It's what we teach here with balance classes, sail classes, exercise programs. We walk around town. All of it's focused on your balance. I'm a neurologist, right? It's all in the brain. Somebody will tell you it's in their hip, it's in their knee. I'm going to disagree. It's all in your brain. So here in the brain are various parts that do various things. Obviously, what this doesn't show is how much they interact between each other. And the second thing it doesn't show is the inside where all the wiring goes. So if this was all I had to learn in med school, I would have aced the class. It got more complicated. So going to start, keep this in mind, going to start with a quiz. And the quiz is somebody in the front row stands up, turns around, goes to the back, gets a glass of water, pours it into the glass, drinks it, comes back. How many different parts of your balance mechanism are involved in this process? Let's break it down. Stand up. If you stand up too fast, bad things happen. Okay, so right off the bat, just standing up, we have to be aware of. Part two is turn around, make a 180 turn. If you turn real fast, the room keeps going. That's not good. Okay? If you walk toward the back, you're using coordination, your left side, your right side, your movements are in sync. And if you look to say hello to somebody at the side, you're going to stumble and fall. You've got to pay attention. If you don't pay attention, you're going to fall. So the front of the brain, paying attention, is probably one of the most critical parts of balance that we don't teach people. So it's paying attention. Next, you get to the back and you grab a pitcher of water and you pour it, and how do you hit the glass? How do you not spill it? Okay, that's your visual system. So your visual system says, I'm going from A to B. I can see one glass and it's here. I don't see two glasses. So we're already adding in more components here. Then we turn around and try to bring the water to your face. Does it tremble? Does it move sideways? How do you get that glass of water to your face? How do you get that soup there without spilling the soup? It's harder than you think, as lots of people attest to. So we're looking at movements, heart, vision, touch, other movements, coordination, attention, 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 and memory. Where am I going when I do this? So right off the top, we've got this complicated system that, of course, I'm going to argue is all in your brain. Julie in the back is going to argue it's in your muscles, but we'll get over that. So the brain knows. The brain knows. Brain is the centerpiece to coordinate your vision, your coordination. What's coordination? How do you define coordination? It's how carefully I can move my muscles where I want to move them. And I can move them in 3 dimensions. I can move them in parallel. One leg knows where the other leg is, and that's all in the brain. So it becomes a critical component in doing that as well. How do we coordinate things? What's muscle memory? How do we remember how to ride a bike? How do we play the piano? That's a coordination question, but it's a memory system. It actually all goes back into the memory to keep you going. An important component, which we don't think about, is what's called proprioception. Where is my body in space? Interesting thought. If I close my eyes and put my hand here, why doesn't it go out here? Or out here? And so somewhere my brain is keeping it level. Okay, if there's a problem in the brain, it's not going to stay level. Okay, so proprioception is telling where your body parts are at any given time and how they coordinate with the other body parts. how do we lose our balance? Every one of these systems can make you lose your balance. So then it becomes imperative that all of us know all of these components. What works, what doesn't work, and how do I adapt to it? So it's an adaptation mechanism. Yeah.
So obviously exercise and doing some kind of daily workout with your body, whether it's walking, will help you find that balance and coordination, I presume.
Absolutely. So if you keep working your muscles and you keep doing physical activity, what does it do? It improves blood flow to your brain. So right off the bat, your brain is better. Second thing is you're training your muscles. And muscle tone is critical because if you've got a weak muscle, you're going to fall. So the weakness in any given muscle is significant. So doing activity, walking, swimming, pick any one, except maybe weightlifting, which doesn't do a whole lot to your balance. But anything that has motion involved is going to improve your balance. It'll improve it both short term and long term. Remember, the brain remembers. The muscles remember. So you can do it in lots of ways. Other questions? Yeah, listen.
Like dancing.
Dancing. I don't know what dancer was going to ask me that question. Dancing is an incredibly important, actually, part of balance. And dancing usually involves music. Remember, music makes you dance, right? You may not know how to dance. If I've got the right song, you're going to tap your foot, you're going to bounce your body. Music stimulates muscles. Music stimulates balance, and it stimulates dancing. Okay, if you go for a jog and you've got a headset with music on, you will pace yourself to the music. It's great to know. You want to speed up, just get a little faster song. Your time gets better. It's actually considered illegal in races to use a headset because you can pace yourself better. You can actually overpace. So any competitive race, this allows headsets. It's an interesting thought. Okay. So what the brain also does, it remembers how each muscle works. Which muscle does this and which muscle does that, and how they can work in sync. So it becomes an important component, again, of movement, of balance, is muscle memory. You think about it. It's important, and you can train your muscles to do that. And needless to say, the cardiologists think blood pressure is all their realm, and I'll disagree. It belongs in the brain. We have this argument all the time. The cardiologists think that you can't have too low a blood pressure because it makes less work for your heart. And my argument says if it's too low and you stand up, you're going to crash. And so I'm constantly raising people's blood pressure, and they go see their cardiologist who lowers their blood pressure. And I can sit down with a cardiologist, we can talk about it only over a glass of wine because otherwise we get into this battle. But I'm concerned about falling, and they're concerned about how much work your heart is doing. I've got a couple of physicians in the room, and they're smiling at me. I can see that. They know my arguments. Yeah, question.
What would be a low blood pressure?
What's a low blood pressure? Well, it depends on each individual, but the cardiologists say 120 or even 110. The neurologists say 130. If you get down to 110, you're going to fall. 110 is fine if you're a teenager. It's not fine if you're a 70-year-old. It's too low because you're going to stand up and fall. The other component that we don't consider with blood pressure and drops up and down is hydration. Summertime comes around, we don't drink enough water, our blood pressure is a little okay, and if we stand up fast, it drops precipitously. So part of maintaining our balance and our blood pressure is water. Yeah.
Well, you mentioned the teenager being different than the old person. What is it? Is it different?
Teenagers have much more pliable blood vessels. Their blood vessels will respond faster. They've got the rubber in their blood vessels, and our rubber's a little bit frayed and doesn't constrict quite as well as it used to. So sometimes it's too constricted, which is high blood pressure. But our ability to adapt up and down isn't as good as the teenagers. They can go from a blood pressure of 90 to 160 and they don't blink. The rest of us would not do that safely.
So if you had low blood pressure all your life,
If it's all your life, you're good. Great. Low blood pressure all your life is wonderful. The problem is, as you get older, you don't adapt to it as well. So even though you've had 90 all your life and everybody says this is great, this is spectacular, as you get older, 90 isn't enough to hold the blood pressure up in the brain. You have to actually let it go higher. Believe it or not, I tell people that sometimes they need chicken soup. And chicken soup is salt and water. And that's what it takes to bring your blood pressure up. You need a little salt and a little water to keep it going. Okay, 90, everyone's going to love your 90 blood pressure until you stand up too fast and you go, whoa, wait a minute, this isn't working. Okay? So the brain needs oxygen, clearly. We get up to high altitude, oxygen is less, we get screaming headaches, and our balance is off. There's not enough oxygen in the brain. If we have lung disease, and we don't move oxygen properly, we're going to be chronically dizzy. And I'll use the term dizzy right now. We'll explain later what's dizzy and what's not dizzy. But so low oxygen is a problem. Glucose. You know, we don't think about glucose and diets in terms of balance. But if you've got diabetes, your balance is off. It's off for a number of reasons, and part of it is the glucose in the brain isn't operating properly, and part of it is the glucose being too high or too low also causes nerve damage. So some of you have heard my talk about memory and Alzheimer's disease, and you know glucose is a big factor in that as well. So we have to be aware that monitoring our glucose level is critical to our well-being, our balance, our ability to go up and down. So we get to another question. Brain needs minerals. Brain needs vitamins. How does that affect balance? And it turns out that vitamin B12 is essential to your balance. If your vitamin B12 is off, your balance is off. How many of us have diets that are deficient in B12? And the answer is none of us. However, we don't absorb it properly. To absorb B12, you need a stomach lining that's good, hasn't been damaged. You need a stomach lining that has an acid environment. And you know, we take antacids all the time. We take Pepcid, we take Tums, and what does it do? It makes us have less acid in our stomach. It makes us less able to absorb vitamin B12. So we have to be really careful when somebody says they have a balance problem. I'm going to look at what's their B12, not their diet, because they can have a great diet. They can even take B12 pills sometimes and it doesn't get into the bloodstream because they need acid in their stomach. Minerals. What are the minerals essential to your balance? Iron, calcium, magnesium, phosphorus. You need the zinc. You need the whole spectrum. So people on some very strange diets, and I can't define strange diets in Sebastopol because that's a third of the population. But nonetheless, you have to be real aware of your diets that may well affect your balance. And then the unappreciated part of balance and the brain is sleep. If you don't sleep properly, your balance is off. And all of us know that if we've done a long day, a long night, and we get up and we try to walk somewhere and we hit the side wall. Okay, sleep is a critical part of balance, and we don't think of it as a modality. That's our balance. So everybody has to be aware of your sleeps. If you're up and down 10 times during the night and your balance is off during the day, guess what? They're related. They really are. Think about your sleep cycle as well as part of your balance. It's back to the brain. I'm biased, I'll tell you.
Is it how much you sleep or when you sleep?
It's quality of sleep. The sleep is the quality. Quality says I get a good deep sleep for 90 minutes. If I get 90 minutes really good and I do that maybe 3 different times during the day, I'm good. If I'm up and down every 10 minutes or 20 minutes because my bladder is bothering me, or I got chronic back pain, or I've got something else that keeps me from sleeping comfortably, I'm constantly half awake, your balance is going to go off. So it's getting more complicated. You realize balance is not just what we think about as, my standing up or my inner ear, or it gets into all of it, and it gets into the brain in great extents. How about vision? One of the great ways to prevent falls is to fix your cataracts, is to get glasses. If you don't see clearly, if you see double, you're going to fall. You're also going to crash your car, which is another story, which the DMV doesn't take good care of. So your vision is part of it. If you're pouring a glass of water and you miss the glass, I don't think it's your coordination, it's your vision. Most of us, can pour a pitcher into the glass. So it's another big factor to keep in mind. Depth perception. 2 eyes gives you depth perception. If you close one eye or one eye is injured, your depth perception goes off. If your depth perception is off, you don't know how close or far something is, and you're going to hit it. And if you hit it, you're going to fall. And as we like to tell everybody who comes through this place, falling is bad for you. And the whole goal on this is to figure out all the various fixable risk factors in terms of falling. And that's what we're going to try to work on. Where you are in space, I love that, called proprioception. Proprioception is one of the great underappreciated medical terms. Most of your primary care docs aren't going to talk about it, but I am. And it says, where am I in space? Where is my hand? Where is my foot in space? You can compensate visually. Okay, so in other words, if my foot is numb, I can look down and see where it is. If my vision is bad and my foot is numb, I don't know where it is, and something bad's going to happen. Okay? So knowing where you are in space can be damaged. It's damaged by a vitamin B12 deficiency. You lose perception of where you are in space, but if your vision's good, you can get away with it. Vision is a critical part of what we do. We talk about balance. It is a part of it. How about the ears? Everybody thinks they get dizzy from their ears, and you certainly can. There's no question. The ear balance mechanism is critical. It is actually complicated. It's got 3 canals on each side that are perpendicular to each other. And they talk to each other. And what happens is if I turn, one canal speeds up and one slows down, so when I turn, I can stop. And if I turn and I can't stop and I keep going, one of those canals isn't working properly. The one we have the most problem with is called the horizontal canal. That is, I turn sideways and I keep going. There are other ones that go this way. Somebody says, I can bend over and I'm on a Ferris wheel. And that's a different semicircular canal. But the most common one, and the people you talk about with vertigo, positional vertigo, is you turn and the room keeps going. Okay, if you roll over in bed and the bed keeps turning, that is vertigo, and that's from your ear. That's an ear focus problem. You can get that from a little piece of sand in your ear. We can talk about it later. It gets more complicated. It gets in the canal. So this canal is running with a little bit of a rough spin. It's not smooth anymore. And the other one is smooth. So the bad one doesn't sync with the good one, and you start to spin. Then the question is, how do I get the sand out of my inner canal? And then I go back to the physical therapist because they can teach you how to do it. There's no drug that does that. It's actually mechanical. So we have the canals that are back and forth. They talk to each other, and they have to be in perfect sync to make it work. Kind of looks like this. The inner ear has, they're real close together. So here is your hearing mechanism. It's the little spiral shell, and here is your balance mechanism. And they're actually separate. You can damage one and not the other. But they have a nerve that's very close to each other. So if you get a nerve damage, you can lose balance and hearing, but more often than not, you can lose one and not the other. So that little spiral is interesting because the inner part is the high frequencies, kind of a small, you can think about small fibers, and as it gets wider, you get lower frequencies. And with age, we all start to lose high frequency. So bit by bit, we can't hear women's voices. You know, the complaint is my husband doesn't listen to me, and the answer is he doesn't hear you. But he hears his poker buddies. Yeah, they've got a different tone of voice. We go to that all the time. But you do lose high frequency. It's worse if you're exposed to noise over time. And bit by bit, so hearing aids bring back the frequencies. So it's really important that everybody be aware that hearing aids are critical to your brain, because you get to hear things and you get to remember things. If you didn't hear them, you didn't forget them, you never heard them. Okay? The semicircular canals are independent of hearing. You can have terrible damage to your canals and your hearing's fine. You know, or you can have bad hearing and your balance is fine. So it's just, when I say it's in your ear, it's more complicated than that, obviously. Question?
What about water in your ear from swimming?
Water in your ear from swimming is generally a good sign. It means that you're exercising properly and frequently. There's nothing dangerous about water in your ear unless it sits there for a week and it gets moldy, which clearly that doesn't happen. Water in your ear is good. It's a good mark.
They say I have nerve deafness.
Yeah.
And that means that letters, it may be hard for me to, like, a D may sound like another letter.
Correct. So nerve deafness is, in fact, it's in the ear. It's part of that whole mechanism that says there's two parts to it. Part one is getting the sound in. Part two is the interpretation of it, and that's a different part of the brain entirely. So we're back here. We've got hearing. Hearing coordinates with attention, with decision making, with speech. So if this is not in the ear anymore, this is what gets to the brain. And the brain has to sort it out and decide what it means. And that's when you miss words, you miss letters. We see it in small vessel disease. We can see it with small strokes. People can hear it, but they can't say it or they can't read it. And it's a damage within the structure of the brain.
Can an ear, can I have that help, or it's lost? Or
Can you have it help? You'd need to have a specialist look at it very specifically. It's going to take some imaging to see if there's damage anywhere in that pathway between here where you hear it and in the brain where you interpret it. So there's some. Well, it may, but you need to have somebody look more carefully at it. It's not a yes/no answer, unfortunately. It's going to take some work on it. But this is an important point, is that if your hearing is off, your memory is off. So this is part of my usual memory talk that says if you don't hear it, you didn't lose it, you never got it. That's where hearing aids make a spectacular difference, is in memory. What do we call coordination? How do I get the soup to my mouth? How do I get the spoon up here? What's the mechanism? We need vision. We need muscles. We need what's called smooth movement. How do I move smoothly through space and not shake? Okay, there are a lot of conditions that cause shakiness, and that affects coordination. If your hand is going to shake and you can see it, your leg is going to shake and you can't see it, but it's going to throw your balance off. So you just have to be aware that this shake is there elsewhere in the body. You just haven't seen it yet. Okay, so somebody, for example, who has very early Parkinson's disease will have a little tremor in their hand, but their walk doesn't look quite normal. You don't see the tremor, but it's not quite there. So when you start seeing tremors anywhere in the body, it's going to affect the small muscles where you can see it, and the big muscles, which is a little harder to see, but it affects your mobility. It affects your balance. It affects how you move in space if you've got a tremor of some sort.
You've got all this information coming into the brain, whether it's balance or sound or whatever. What's the sorting mechanism in the prior?
Okay, so yeah, what's the sorting mechanism? I'll go back to slide number 1 where it's right up in that frontal lobe, where it says attention, planning, executive function, all of that material comes in the front, and you decide what to do with it. So there is a mechanism that it's not in the motor system, it's not the sensory system, it's actually in the integration, which is the frontal lobes. People with frontal lobe damage may have good muscles, but they don't know how to use them. Okay, they may have good vision, but they're not sure what they're seeing because they can't interpret the information. So it becomes a problem in its own right of interpretation. So people you've seen people in car wrecks who bang the front of their brain, and you just, well, all the parts are good, but their movements are off, their balance is off, their thinking is off, because all that is set in one part of the brain. That's the critical part of the brain. That's the part of the brain that humans have that's about 5 times bigger than what every other mammal has, is that section of brain that interprets all of the input. Okay. Coordination is one of them. There are a lot of animals better coordinated than we are, trust me. But how we use it is a different story. That becomes a different question. Yeah.
For the brain, if there's a concussion, is where personality changes take place.
Yeah.
I didn't see that on your diagram, personality.
Well, I couldn't put all the spots. I could list everything in the front of the brain. I'd need 2 more slide decks. But you're right. Personality, judgment, judgment's in the front of the brain. How well you make the right decisions. Somebody sold you the Golden Gate Bridge and you bought it and you did it again next week. Yeah, that's a decision-making process that clearly is broken. Okay. So we see that. So yeah, the front of the brain is going to be critical to interpret all the information. Part of it is this, the nerves in the feet. Where are the nerves in my feet? What do they do? Why do I need them? And it's interesting. You think about the nerves as a single entity. But the reality is there's a different nerve for pain. There's a different nerve for temperature. There's a different nerve for light touch. And there's a different nerve that tells you where you are in space. Proprioception. And I put it in capital letters because that's the critical part of balance. So I can have a numb foot because the small fibers of pain and touch are damaged, which is typical in diabetes, and yet my balance is still good because the fibers for position are bigger, thicker, and stronger, and less likely to break down. So the people with diabetes, my feet are numb, but they're not falling because the proprioception is good up the spinal cord to get to the brain. So your peripheral neuropathy, the thing that gets people in to see us is because their feet hurt or their feet are numb. And what doesn't get them in is a loss of proprioception. They come in because they're falling and they have no idea it's their feet that are the problem. These are big nerves. These are critical nerves. Now, this is a good example. The nerve from your foot to your brain goes right through the back of the neck. And it's right in the back. It's right in the area where we tend to get little disc disease. We get some degenerative changes. We get all kinds of stuff there. And the only symptom you may ever have is loss of balance. because the only thing that's really impacted is the pathway from the position sense in your feet up to your brain. Your feet can feel it, but your brain doesn't know it. So you're cutting off the pathway. And this, to me, is one of the great underappreciated, underdiagnosed reasons people have problem walking and problem with their balance is because they have this damage in their neck, but they don't have neck pain. If you don't have neck pain, how can you have a nerve damage? And the answer is it's anatomy, anatomy, anatomy. It's in just the right spot to interfere with telling your brain where your feet are. And so now we come up with, so how do we put this in composite together? So your balance is a mixture of your vision, see where you're going, your inner ear, keep me going from side to side, and my sense of position, okay? Now, you need 2 out of 3. You only need 2 out of 3. Yeah, people who are blind don't lose their balance necessarily for that alone. People who've got bad ears will drift one way or the other, but they won't necessarily lose their balance. But if you've got bad damage in your neck and it gets dark at night, you're going to crash. Okay? The greatest thing I always remind people is night lights, night lights, night lights, because you get up at night, you may have a little bit of cataracts, but if you can't see the floor and you don't know where it is because your feet don't feel it, you're going to fall. So vision, inner ear, position sense, proprioception of where your feet are becomes the triad, and you just need 2 out of 3. Okay. One of the great questions I'll ask people, and they say they're dizzy, they fall. I said, if the light gets dim, do you fall? And they go, oh yeah, can't function in dim. Other people can do fine at night. They would zigzag everywhere. Somebody who doesn't know where their feet are, and the light gets dim, just lost 2 out of 3. And you need 2 out of 3, okay? So it's really critical. Now, that raises the question, how do you explain this to your doctor? Doctor, I'm dizzy, is one of the things that will send your doctor running out the door screaming, okay? Doctor, I'm dizzy means everything and anything, and you gotta be good at explaining what doctor, I'm dizzy actually means. There's my colleague in the back who happens to be an emergency room doctor, and he can tell me when it says, doctor, I'm dizzy in the ER, he runs. I don't want to hear about it. So, what are the medical issues? What gives you problems with your balance? Neuropathy. Back we go. It's neuropathy if your feet are damaged, if you don't know where you are in space, you're going to have a problem with your balance. Unless you compensate very aggressively visually. Okay? Which brings me to the other question I didn't put in here, which is attention, attention, attention. If you don't pay attention, you're going to fall. Okay? None of us, there are probably some teenagers who can run around with their eyes closed and nothing happens. The rest of us have to pay attention. We're going to fall. Neuropathy is diabetes, common, and just normal aging. I hate to say it, but there's a normal aging of nerves, even without diabetes. They're just less effective as we get older. And we're getting older. And we've done really well with all the other medical conditions. That is, heart disease, 30 years, we gained 30 years on heart disease. I was a student, we had all the 50-year-olds with heart attacks, now they're 80. Strokes. Strokes used to be in 55, 60-year-olds, now they're also 80. So what we've done is we've all aged in a healthy manner. We've avoided a whole lot of stuff. We haven't been able to avoid the normal aging of nerves. They're going to age, so which means that how do we compensate? And it goes back to attention, attention, attention. Okay, we have to know that our nerves aren't as good as they used to be. When I climb the stairs really fast, I'll use the banister, thank you. I didn't used to. Maybe I should do this more. It's a safer bet. Yeah,
I think neuropathy can also be caused by spinal stenosis if there's, disc problem. But what I'm wondering is if you're having gait instability somewhat, but you're not afraid of falling, do it, but it just doesn't feel natural. Maybe through, say, walking a certain amount regularly, it trains the muscle memory in the legs.
okay, so good point. Yeah, so you can get nerve damage from spinal injuries in your back, no question. That's a single nerve or two nerves. It's not going to be the what I call the generic sense of neuropathy. So neuropathy is one thing which is a generic, all the nerves are taking a hit. Sciatica, disc disease, spinal stenosis is picking off individual nerves. So in that sense, you can compensate a lot. If you've got a slightly weak leg, you can spend a lot more time working with it, but your proprioception should be still good. Proprioception doesn't get damaged from a spinal stenosis for the most part. It does in the neck, but not in the back. So it is a process. Now, what else gives neuropathy? Diabetes, aging. What I didn't put in there actually is certain medications. There are certain medications that damage nerves. They're essential medications. They really are important. A lot of them are chemotherapy agents. They've saved lives up and down, but they do leave damage. And the most susceptible area for damage is the nerves. So we're going to see it with chemo, the famous chemo brain. But more than chemo brain is chemo gait. The balance is off. The drugs are getting better in terms of less side effects, but they're still out there. Some of the other common antibiotics even cause nerve damage. So you have to be aware of that. There's a drug we take all over the world because it's great for stomach bugs and GI illness called Flagyl. If you take Flagyl long enough, it's going to damage your nerves. It's reversible. You quit and it goes away. But you have to recognize that some of the drugs we take cause nerve damage. Parkinson's disease, I put on here, it is more common strictly because of aging. There's more Parkinson's because people are just living longer. It's very much a disease of age on it. It is, however, and this is controversial, not to me, but to some people, is that it's a factor of all the herbicides in the air and in the water. Herbicides and pesticides raise the risk of Parkinson's. Best example is athletes who play on grass. Football, soccer, golf are playing on lawns that have no weeds. There are no weeds for a reason, and they're coated in herbicides. And those herbicides cumulatively raise the risk of Parkinson's disease. It took the US Army about 30 years to acknowledge that Agent Orange really did give Parkinson's disease in Vietnam vets. Yeah.
Years ago, I heard, and I forget where from, that there was not a recorded incidence of Parkinson's before the Industrial Revolution.
Yeah, it's interesting. There was no Parkinson's before the Industrial Revolution. It is tricky. The first reported case was in the 1870s, 1860s, which was in the middle of the Industrial Revolution, correct. I think part of it may have been people died younger. They died of tuberculosis, they died of a lot of stuff. We didn't have as many people hitting the prime age for Parkinson's, which is 70. Not that many people got there, and not that many doctors wrote articles about it either until James Parkinson actually did that in I think it's 1870, I believe. So it's hard to imagine it didn't exist. It's more likely that it didn't get reported at that time. No doubt the Industrial Revolution and all the chemicals in the air have added to it. That I have no doubt. So what does Parkinson's disease do to your balance? Let's go back for a minute. It changes the way you walk. Your walk becomes a little stiffer. Your steps become a little stiffer. Your ability to move your arms goes down. If you watch somebody with Parkinson's walk, they don't swing their arms. Now, if you think about walking, One foot goes forward, the arm swings. You've got a balance mechanism between your arm and your leg, and you're shifting weight. So your weight shifts from one side, and your arms are part of that mobility. And if your arms don't do it, you've lost part of your balance mechanism, which was your arms compensating for shifting the weight from one side to the other. So moving your arms is part, and that's what you lose in Parkinson's. Everyone worries about the tremor. The tremor is 10 years into the disease. The first sign of Parkinson's is you lose your arm swing. And your chief complaint is, my balance is off.
Don't you shuffle?
That's late. Shuffling is a late process. Tremor is late. The first process you see is that loss of arm swing. The muscles get stiff.
You're talking about an age where a lot of people have problems with their shoulders and their knees for orthopedic reasons.
Correct.
The arthritis and the stiffening of joints. And I'm wondering how often that plays into the confusion around presentation. And falls.
It's everything else.
Well, I'll give you my answer to it, which says that the loss of movement in the shoulder precedes the frozen shoulders. Okay? In other words, the person who doesn't move their arm when they walk will develop shoulder problems. My orthopedic colleagues will tell me, I treated these bunch of people for frozen shoulders, I injected them, I did this, and 5 years later, you diagnosed Parkinson's. And the shoulder was actually the first part of it. So the shoulder was the first symptom, and it caused the shoulder. The knees, I'm not sure, but the shoulder for sure. Yeah.
Can you describe what the advantages are of being diagnosed early with Parkinson's?
Early diagnosis of Parkinson's prevents the secondary complications. The most important secondary complication is falling. People with Parkinson's die because they break their hip and end up in a hospital. And they get sick in a hospital. The way you can, once you know it's there, you get into a vigorous exercise program. You get into a dance program. Dancing is the marvelous treatment for Parkinson's. You get into a singing program because people don't breathe properly. My prescription pad says, join a chorus and join the gym and take a dance class. It's all part of, and it's written in. I write it in because it's prevention strategy. Parkinson's is a degenerative disease. I can't stop the progression, but I can prevent as long as possible the complications.
So you don't start medicine early.
You don't need to start early. You can, but often you don't need to. What you need to do is come up with a prevention strategy. The Parkinson's support group in Sonoma County has dance classes. They have boxing classes. Okay, they have singing classes. They have the greatest programs. Is the Parkinson's support group here in Sonoma County. I love these people. They've done more than any of my physician colleagues.
Is there a neuropathy support group?
There is. I don't know where it is right now. There is a neuropathy support group. I've given talks to them a couple of times, but I forgot how to reach them. Yeah, there is a group for that as well. Okay, so strokes. Strokes affect the gait, pretty obvious. If you got a weak leg, you're gonna drag it, you're gonna trip. So what's the key to stroke prevention? Blood pressure, blood pressure, blood pressure. As long as that's the best we can do on any of the stroke prevention is watch your pressure. It works. Medications, big issue. Some drugs throw your balance off. Some of the sleeping pills throw your balance off. You take a pill to go to sleep, you get up at 2 in the morning, go to the bathroom, and you fall. And it's the drugs. So you just have to be aware that a lot of the meds we take, particularly ones related to sleep, are going to throw your balance off. So be really conscientious, be aware of it. Alcohol. We don't admit how much we drink. Flat out statement. Ask anybody how much they drink, they'll give you a number, and then you double it. And if you're a med student, an alcoholic is somebody who drinks more than you do. But alcohol is kind of under the radar. This is wine country. Everybody has a little drink. You bring a bottle of wine wherever you go. I just got back from Spain, and the bottle of wine is on the table with a pitcher of water. It just comes with the meal. They don't even charge you for it. There's a bottle of red wine on the table. It's a cumulative effect. It affects your brain. It affects your peripheral nerves. It affects your stomach's ability to absorb B12. All of those are tied into your alcohol intake. And it's a cumulative effect. You know, the teenagers who get rip-roaring drunk don't generally have long-term effect unless they crash their car. The 2 drinks a day, 20 years later, you're in trouble. Herbicides I talked about, gasoline, paint thinners, all of these hydrocarbons damage the brain. They have a very distinct mechanism to damage the brain. How do we evaluate balance issues? What do we do? You look for the simple stuff. Is your B12 too low? Is your thyroid off? Is your kidney function off? Look for toxic environments. People who live in toxic environments have more problems. It's a cumulative effect of breathing bad air. Kathy? Yeah.
What you do about it is the other thing. Is it worth purchasing organic produce and quitting golf if you love golf?
Well, you know, I personally would think so. And if you read Michael Pollan's book, The Botany of Desire, and he talks about how potatoes are grown and how much pesticides and herbicides are poured onto potatoes. If you read that once, you'll never eat a commercial potato again. It's scary. Can you limit your exposure to all these things as much as you can? I mean, you grow your own gardens, you get your produce from the farmers markets, you can do a lot of stuff, but it's in the air. It's certainly in our water. There's enough herbicides, you know, the Roundup is in all the well water. It's in the Russian River. So it's really hard to say I can go completely clean. We can be relatively clean, but I don't think we can be completely clean. Yeah.
Just noticing, having had lunch a while ago, and I'm sitting in a warm room, and I'm getting woozy. And that happens to most of us at some time of the day or another, and that would affect balance and the ability to process.
Yeah, it does. And, you know, when we get warm, we vasodilate. That is, the blood goes out to the surface. There's less blood in the pumping system. And so there's just less blood going to the brain. And the first sense of less blood in the brain is a woozy feeling is what does it. So what else do we need to know? We need how much alcohol you use. Somebody's got to figure out how your position sense is. And I can tell you now that the general medical doctor is not going to be able to figure out if you have proprioception in your feet. It's a specialized thing. It's literally just a tuning fork. You take a 128 hertz tuning fork, you put it on somebody's ankle and they can't feel it, and you put it on their knee and they can feel it, and you go, that's why your balance is off. To me, it's the simplest test. I teach my students this all the time, but how many people have ever had that happen to them in a doctor's office? I got no hands going up, guaranteed. You got one. Neurologist, put a tuning fork on your foot, but there are a few neurologists in this county, so it's hard to find them. Pardon? Physical therapists? Oh, good. That makes me really happy because that bypasses all my colleagues who are unaware or don't bother with this. Yeah.
So you started out to talk with everything's in the brain.
Yeah.
And you just described the test. Put a vibrating thing on your ankle or in your knee and you saw a difference.
Right, but what I'm testing is how that signal gets to the brain. So it's not, I don't care about the ankle really. I want to know, does that signal get to the brain? Does it get blocked? It's blocked in the spinal cord, which is technically part of the brain. There's a block in there so that it doesn't get the information. That's the bottom line. You need a good eye exam, obviously, and find out who in your family has bad balance. Okay, big question. Doctor, I'm dizzy. How do you get around that? You've got to explain to your provider, is the room spinning or is it not spinning? Do I feel like I'm on a boat that's rocking or is the room going around? And those two questions right off the bat make a difference, whether it's an inner ear issue or it's anything else. Room spinning is inner ear. That's that whole vestibular mechanism. Everything else, visual blurring, your blood pressure is dropping. When does it happen? Does it happen after I have too much to eat? Does it happen when I'm dehydrated? Does it happen? You can start to figure out the parts of it. Getting up, bending over, mornings, If you roll over in bed and the bed keeps spinning, that's an important part. So you can tell the doctor what it is. But if you just say, "Doctor, I'm dizzy," they're going to walk out. Doctor, I'm dizzy, by the way, is also has a certain language issue. In the Philippines, "Doctor, I'm dizzy" means I'm sick. And when you see Filipinos locally here and they say, "Doctor, I'm dizzy," you don't start looking in their ear, you look for their heart attack. I was teaching in Manila for a while, and it was strange how many people with really weird diseases, first statement was, "Doctor, I'm dizzy." So you have to be aware of that. Okay, pay attention, everybody. That is the critical takeaway line for all of it. Now, this was a statistic came across my computer 2 days ago. Deaths from falling has gone up dramatically. It's a scary statistic. And it means that we're using too much alcohol, too much medicine, we're not paying attention.
Some people, when they look up, they get dizzy.
Yeah. Yeah, there is, actually, because when you look up, you also bend your neck. And if you bend your neck, you kink the artery in the back of your neck, which goes into the part of the brain that makes you dizzy. If you can look up with your head straight, it won't happen. But of course, you got to do that. Yeah.
Have you heard anything about whether these are effective, these acupressure wristbands for
You know, I don't know. People use them for seasickness too, and I don't know. Some people say they work really well. I don't know the mechanism. Placebos are great. I love placebos. They have no side effects. They're great stuff. Yeah.
If we're sitting for an hour or something like that, many of us find that standing up is a new experience.
Yeah.
The balance, is that the brain?
That's the blood pressure. You stand up slowly and hang on and count to 5. But if you get out of the car after a long ride, you stand up and you stand next to the car before you walk across the parking lot. If you jump out of that car and hit across, you're gonna fall. You had a question here, I'm sorry.
The only dizzy spell I ever had was several months ago, and you described your person perfectly when you said you don't know where you are in space. It was the strangest feeling. I just stood there and said, "Whoa," and I thought, well, I'm not going to fall, so I sank down to my knees.
No, that's good. Yeah, no, a sudden change like that, which is what I call a total change, typically is your blood pressure dropped. And so heart may have skipped 2 beats. If your heart skips 2 beats, you're going to get that sense. And then it catches back and everything goes. Okay, thanks, folks. So we're technically over. We can leave or wander. I'll stick around so we can take questions.